Good afternoon. I'm Steve Rehorst, one of the public information officers with the Watertown Area COVID Task Force. We have a couple speakers today come in and talk about various things with long-term care facilities. We have some representatives from Prairie Lakes Healthcare as well as Sanford. So thank you everyone for joining us. But hope you've been enjoying the beautiful weather out there. Remember to hydrate and remember that sunscreen is your friend. Make sure and use that. We've had some calls out there about people being affected by the warm weather. So make sure to do that. Take care of yourself. First up, we have Mayor Karen with a community update. Thank you.
Good afternoon. Today is Tuesday, June 2nd, 2020. In South Dakota, we now have 89 people hospitalized with COVID-19 and 62 deaths. In Cottington County, we have a total of 37 cases and 26 are recovered. So that's 11 active cases compared to 17 just last Thursday. In our region, we have 25 active cases now in a 9-county area, down from 45 1 week ago. That region includes Clark, Day, Dual, Grant, Hamlin, Marshall, Roberts, and Spink counties. These are people that would utilize our hospital, shop in our stores, go to our restaurants, and use our recreation facilities. Last night, the City Council met and they voted to open up the City Auditorium for business. And the county is currently utilizing some of the offices in there. They also ratified the Park Board recommendation to allow tournaments to use the ball fields. And they will be managed, those tournaments will be managed by the local associations. And there's a big long list of requirements that everyone that participates has to follow in order to be safe. There are rumors of protests going around, and right now those are just rumors. There's no truth to anything. The police department and the sheriff's department are staying on top of everything, and they are assuring your safety. We need to stand together for peace, for all people, people of color, people of different age, and all sorts of things. We don't do any good being against one another. We need to support our law enforcement and just stand together. That's how we're going to get through this COVID crisis. That's how we're going to get through all the troubles that we face in our country today. So we need to just remember, together we are strong. And we have quite a few people here today. We have Lauren Diekman, who will be up next from Jenkins Living Center, Jennifer Seek from Prairie Lakes Healthcare System Lab, Cindy Midland from the Sanford Clinic, and Beth Schultz, also from Sanford Clinic. They're all talking today. But up next is Lauren Diekman.
Thank you, Mayor. My name is Lauren Diekman from Jenkins Living Center. I'm the long-term care representative on the healthcare branch of the Watertown COVID Task Force. I just want to provide a brief update on long-term care activities in the city. Don't have a lot to say today, but kind of a big thing has happened over the past 2 weeks. Long-term care facilities in the community have been complying with the requirement by the South Dakota Department of Health that all residents and staff be tested for COVID-19. This mass testing provides a baseline to determine the status of each nursing home and assisted living facility in the state so that a plan can be developed for future testing. Once all test results are recorded, the Department of Health has said that it plans to require random weekly testing of residents and staff, but no date has yet been set for when that will begin. In Watertown, our 2 nursing homes in the community, Aventera Watertown and Jenkins Living Center, have completed all testing, and the results were negative for all residents and staff. Now, the test results for Jenkins initially revealed 3 positive resident tests, but those individuals were immediately retested twice over a period of a few days, and all follow-up test results were negative. The 3 assisted living facilities in Watertown, Edgewood, Stony Brook, and Meadow Lake, are currently in the process of being tested for all of their residents and staff, and they will be awaiting those results. We know that our resident family members are wondering when visitation will be opened up again, but I'm afraid at this time there's no firm date on when that will happen. The federal government has provided some guidance to state health departments on a 3-phase reopening plan, but the facilities in South Dakota are still considered to be in phase 1, where visitation continues to be restricted. The staffs in each of our community's long-term care facilities continue to find creative ways of keeping residents and their families connected, but our goal remains to do whatever is necessary to keep our vulnerable residents safe. So that concludes my remarks, and next up is Jennifer Seek, Director of the Prairie Lakes Healthcare Systems Laboratory.
Thank you, Lauren. Good afternoon, everyone. I was asked to talk today a little bit about the different tests that are available for COVID-19. So there's basically two types of tests available. One is a molecular or a PCR, also known as a PCR test, and the second is serology, also known as an antibody test. So a PCR test is looking for the virus itself. This test is collected with a swab, and this test is used to assist in diagnosing an active infection. An antibody test is a blood draw, and it is looking for antibodies to the virus, not the virus itself. If the body is exposed to the virus, it will produce antibodies. This type of test might be useful in knowing if you have ever been exposed to the virus. Ideally, if you would have a positive PCR test, your body should develop the antibodies, and in 8 to 10 days, from then, you should be able to come and have your blood drawn and have a reactive antibody test, meaning that your body developed antibodies. One question that we get a lot, and it's referring to the PCR or molecular test, is why did my neighbor get their result back right away and I didn't get mine back for 3 days? The main reason is symptoms. At Prairie Lakes, if you have symptoms, we will run it in-house with the same day turnaround time. But if you're asymptomatic, we will send it to a reference lab with a 2 to 4 day turnaround time. And the main reason for that is because we get our supplies for our molecular testing through the state. So we follow the state's criteria, and they do not test asymptomatic patients. So if you have symptoms, an antibody test would not be appropriate, because an antibody test your antibodies will develop later after you've already had a positive PCR test. Just to reiterate the symptoms of COVID-19, it's cough, shortness of breath, fever, chills, shaking with repeated chills, muscle pain, headache, sore throat, new loss of taste or smell. So if you have any of those symptoms, you should be able to get a rapid PCR or molecular test done with same-day turnaround time. There are many different reference labs, many different places to send this testing. And I know all the clinics in town have their own criteria, and they're based off of symptoms too. If they're asymptomatic, a lot of times they do go to a reference lab. If you have symptoms, they can send them to Prairie Lakes, or they send them to a reference lab, and part of that is a provider decision. So I think that's all I have today. Thank you.
Good afternoon. I'm Cindy Midland. I'm the clinic director for Sanford Clinic in Watertown, Clark, Esteline, and Lake Norton. I'm also a member of the Cottington County Emergency Management Task Force, Unified Command for COVID-19. Want to talk to you about the need for our patients to come back in for routine care, and also about visitor policies. In healthcare, we continue to have your safety as a top of mind and have strong measures to keep you, our staff, visitors, everyone safe. We screen Sanford employees daily. They are masked. We take their temperature. They're asked several questions. That's done, as I said, on a daily basis to make sure that we're well to take care of you. These safety measures make it a safe place for our patients and for their visitors. And it's also allowed us to change our visitor policy. I think a lot of people were aware that we were previously not allowing any visitors. But we feel that given the current environment, our safety measures, as well as the level of active cases in the community and the region, that it's a safe thing to do. And we want to allow our patients to have their family and loved ones with them when they can. So at this point at Sanford Clinic, we allow one adult visitor with each patient, and all visitors are required to wear a mask. It can be a cloth mask, one of their own masks. If they do not have one, we will provide one. Both the patient and the visitor is screened. We take their temperature, ask them some questions, make sure they're not symptomatic or been exposed or recently tested for COVID. In addition, the screeners do all of that. They make sure that you have, as I mentioned, a mask if you don't have one. So we think it's important as a part of healthcare to have those visitors now that we feel that it's safe to do so. I think it's been especially important for our OB patients for their visits, especially for those ultrasound visits. They want their very special time to get to see their baby for the first time, and they want their significant other or their family member with them. It's also been important for our elderly patients who typically have a spouse or an adult child member of their family, not because they need them as a caregiver, but more that they typically have them along for visits, for questions. That other family member provides some good feedback that's helpful for the provider to know how that patient is doing. And of course, children always, as a minor, have a parent or guardian with them. That has not changed. I would also mention that Brown Clinic also allows visitors to their clinics, and has similar screening process, but wanted to point out that Prairie Lakes Hospital and Prairie Lakes Specialty Clinic still does not allow visitors. This is to protect patients and patients' loved ones. It's a different situation. They see people in emergent care, emergency, inpatient. These are higher risk patients, so it makes sense for them at this point in time to continue their no visitor policy. They do have a few exceptions, including patients receiving end of life care, births, cases involving minors. And if you have questions, you can visit their website at prairielakes.com. I guess I would always encourage, if you have questions about visitor policies or anything else at your particular healthcare facility, to call ahead or check their website. We've talked about how it's safe to come back into our facilities. Next, I'd like to introduce Bethany Schultz, who's a certified nurse practitioner in family medicine at Sanford Clinic. She's going to talk about why it's so very important to have adults stay current on their routine care, wellness visits, and screenings, such as mammographies, colonoscopies, things like that. On Thursday, Dr. Tracy Perrette, a pediatrician from Sanford Clinic, will talk about the need for keeping your children up to date on their wellness, their development screenings, and their vaccinations. But today, to discuss medical needs of our adult patients in this community, I introduce Bethany Schultz, certified nurse practitioner.
Thank you, Cindy. First of all, good afternoon. I just want to thank you all for being here on this nice, warm, sunny day. Well, not too sunny now, but beautiful weather we've had the last week. I just want to touch base on how important it is to continue with follow-up with your healthcare provider in regards to your acute and chronic health issues, even during a global pandemic. We are currently seeing situations in which patients maybe should have been seen sooner for an acute visit, or did not follow up on a chronic condition in the recommended time frame, and that shift is being directly related to COVID concerns. We do understand these concerns, and we are taking steps to provide the safest environment possible. But it's really important to remember that management of these acute and chronic conditions outside of COVID is still very critical. Worsening of known chronic conditions can actually increase your risk and put you in higher risk category for COVID. As been mentioned, we do continue to provide exceptional and safe care for those in need, those needs and that should not wait. We continue to keep your safety at a forefront and closely follow state and federal guidelines. We have implemented aggressive safety measures designated to prevent the transmission of COVID. Some of them, again, have been mentioned, such as every staff member is to wear masks in the clinic along with visitors. We do screening of employees and visitors with temperatures and symptoms. Limiting personnel into certain areas and visitors that we don't need excessive people in those rooms. We have plexiglass and social distancing measures going on in the waiting rooms, and improved cleaning protocols per CDC guidelines. We do also have telemed options, which is a great option, but keep in mind that there are certain limitations to that as well. We can't always listen to your heart and lungs if need be, check certain concerns you may have, and it's always still good to keep that face-to-face option open. We want you to know we're prepared and ready to resume essential non-COVID care, because together with the support of the community, we have flattened the curve and slowed the spread of COVID-19. I personally, and on behalf of the medical community, would like to say thank you to everyone, all the members of the Watertown and surrounding communities for your efforts in making that happen. While our markets do appear safer than many places in the country, we will continue to monitor the situation closely. We have plans in place to quickly adjust in the event that a hotspot presents itself or we have a sudden increase in COVID cases. The reality of the matter is that COVID will continue to present in our community for quite some time, and I think we all know that. We will continue to put safety first while balancing our resources to care for COVID patients and non-COVID needs of the communities that we serve. We want you to know that we are here for you and your healthcare needs, whether it be COVID-related, management of chronic healthcare conditions, or management of an acute healthcare issue. Thank you.
Thank you, everyone, for your great presentations and information today. I'm Jennifer Bender. I'm the other Public Information Officer for the Watertown Area Task Force, and I do have a few other updates from people who were unable to present today. So the first is from the Auditor's Office. So as you know, today is primary election day, and they have a few tips if you still need to get out and vote. So the first one is just get in and get out. We all like to see our neighbors out at the polls, but it's important to not stand around and visit. Just please fill out your ballot and get out. Know your precinct number and your party before you go. And if you have a chance, look at and see what is on the ballot. Masks are strongly recommended, and they ask to please observe social distancing. And then finally, the polls do close promptly at 7 p.m., so make sure you go in and put in your ballot before 7 p.m. Secondly, I have some information regarding the community transit of Watertown and Sisseton. They are going to begin their services again on June 8th. They are they're requiring, actually, all riders to wear a mask. If you do not have a mask, they'll provide one for you, and their dispatchers can screen you when you call and ask those kind of questions. So they're going to be screening for COVID symptoms as well, and they will not transport anyone with COVID symptoms to a medical facility. They will continue to clean vehicles at every opportunity and practice good hygiene, like washing their hands and using hand sanitizer. So if you would like to book a ride with the Watertown Transit, as a reminder, they must be scheduled in advance at 3 p.m. the day before by calling 605-882-5287. And if you do think you have any COVID symptoms and you are unsure what to do, there is a resource, the COVID hotline, that you can call. That's Monday through Friday, 9 a.m. to 9 p.m., Saturday, 9 a.m. to 1 p.m., and Sunday, 1 to 5 p.m. And you can call the COVID hotline at 753-1408. So that's the last of my updates for the day. Are there any questions from the media? No? All right. Thank you, everyone, for joining us today. The next briefing will be Thursday at 3:30 p.m. Have a great evening.